Today, there are laws in place that force the parents to choose between hospice and palliative care and curative care. And our goal is to so ingrain hospice and palliative care into health care for children that it is just an ingrained part of the healthcare system.
My focus has been on family-centered care. I don't believe in treating diseases in isolation. How can you isolate the disease and only pay attention to the medical piece?
We're there to provide that listening ear, that professional training to advocate for these young patients as they go through really, really challenging things.
You know, I brought into the program here a cancer survivorship program because children must be taken care of after they're treated, after they're better, because the post-traumatic stress syndrome, the medical problems that occur with them after they've been treated, the employment issues, the insurance issues also have to be taken care of. I've introduced palliative care, which I believe in very, very strongly, and not palliative care, which means end-of-life care, because the minute you use the word palliative care, people are thinking, all right, everybody's dying. It's not. It's actually care of the child and the family from the day of diagnosis through treatment and beyond.
Listen to the patients. Just let them voice themselves. I mean, sometimes they can't voice themselves the right way, but just tell them to just say what they feel, whatever that may be.
One example I would say that was critical for us to have was the support of child life specialists who from day one would get involved and make our daughter feel comfortable with what was going on around her. So I think that was really critical and key, and I hope more and more hospitals adopt that sort of model of support. I think it really helps families and children in particular because they don't have much decision making in the situation and it can be a fearful one.
Every mom have to listen to your child. You cannot just, they are just innocent. They can't take themselves out the way they are.
It's important that an emphasis on quality of life happen from the time of diagnosis really throughout treatment. Treatment can have a lot of ups and downs as you go through it.
And for Brian and I, there was no choice but that we would care for Ellie and she would be home with us and our family. We had to have her with us, no matter what. And so we brought her home. And she lived for 3 more years. We wanted to be able to touch her hand, to touch her face, to give her kisses and hugs. And so that's what we did. We had her at home. It was very challenging. By the end of that week, Ellie was hospitalized because we couldn't care for her. And there were a lot of situations that as parents, we just didn't know what to do. And so I called the insurance company and let them know she's been hospitalized. This is costing a lot more than if we had a nurse at home caring for her.
Were we hurting on the inside? Absolutely. But I think that we felt that, hey, these are the cards we have. And time short, we just accepted the situation for what it was, and we decided at the very beginning that we were going to make this the best for her, the best for our kids, and the best for us, however you could. And I think that it's hard to do.
She passed away just last May in hospice care. We had her in hospice care for 14 months, and it was a wonderful 14 months for her.
It was a comprehensive treatment they were providing her, and it really, really made the end of her life, her last 14 months, so much better than it would have been without them.
Yeah, the coordinated care was the biggest piece that really was so impressive with getting hospice help and palliative help.
There's no need to give up hope if you're in a situation where you're getting integrated, comprehensive, all-inclusive care. I never gave up hope
for
Joanna until after she died. this whole concept of giving up hope is a red herring. I mean, hope is there and is always going to be there, along with love. And just because you have comprehensive palliative care or hospice care doesn't imply an absence of hope or a need to get rid of it.
I think that by witnessing what burden oftentimes they have to go through, we will be able to spread the mission that CHI has, which is to ease everyday life of a family with a very ill child. I feel that the mission CHI has, which is provide to those families such a comprehensive ongoing care where they do not need to burden themselves with making these impossible choices, that is absolutely incredible mission that we hope we can spread.
Thank you.
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 Thank you. Thank you.
Thank you.
Thank you very much.